Okay, let's dive right into this. We're looking at public sector pay in Trinidad and Tobago for 2024-2025, specifically education and health.
That's right. And our mission, really, is to figure out why the salaries in these absolutely critical services have gone in such different directions.
Based on the info we've gathered, yeah. It
Yeah.
seems complex.
Well, what's fascinating is that it seems less about the profession itself, teaching versus medicine, and more about the industrial relations setup, the system for negotiating pay.
You mean the two tracks?
Exactly. You've
Okay.
got the chief personnel officer, the CPO, handling collective bargaining for groups like teachers, and technically public service doctors, too.
Okay.
Then there's the other track, the Salaries Review Commission, or SRC. They set the pay for the really high-level positions, think ministers, judges, top officials, definitive salaries.
Right, and that SRC track, that's important because it kind of sets a benchmark, doesn't it, at the very top?
Precisely. Look at the Minister of Education. After the 120th SRC report was accepted, their monthly salary for 2024-2025 is set at $52,159.
52,000. Wow.
And get this, it was retroactive to October 2023, but only actually implemented in February 2025. That's significant back pay.
So a clear signal from the top about, well, the capacity for large increases in back pay.
Absolutely. It creates a certain climate, certain expectations, perhaps.
Okay, so that's the context at the highest level.
Mm-hmm.
How did things play out on the ground? Let's start with case study 1, education. The teachers.
Right. Well, the teachers union, TTUTA, the Trinidad and Tobago Unified Teachers Association, seems to be a good example of a functional system.
Functional how?
They engaged in structured bargaining, successfully concluded their 2020-2023 agreement. That process actually moved their salary scales forward.
And the result, what did they actually get?
TTUTA reported an overall 8% increase in salaries. There are also some smaller things, like a new $51 monthly cost of living allowance and a $600 annual allowance.
So an 8% baseline bump is the main thing.
Yeah, that's the core salary impact. If you apply that 8% to the previous baseline from 2019-2020, you get a projected monthly range for a teacher I for 2024-2025 of roughly $11,000 up to $15,717.
So 11 to nearly 16,000 a month. It shows the system worked for them. They got an update.
Exactly. The mechanism delivered a quantifiable result. Progress.
But then we pivot to health. Case study 2. And the story is, well, quite different.
Starkly different. Here we see what looks like a stalled system. The historical bargaining body for doctors, MPT, the Medical Professionals Association, is reportedly in disarray.
Disarray.
Reports suggest leadership issues, a lack of consistent representation for years now. It creates a vacuum.
And the consequence of that vacuum?
Stagnation, pure stagnation in official pay. The official salary scales for doctors are still anchored to agreements from before 2013.
Before 2013. So what levels are we talking?
They effectively reflect 2015 pay levels. So a house officer that's an intern, their official monthly salary is $12,434.
Okay.
And a medical officer I, someone just graduated, their official pay is $15,077 per month.
Wait a minute. $15,077. Let me compare that. The top of the new teacher I scale is $15,770. So a newly graduated doctor's official starting pay is actually less than the top end for an established teacher I after their recent raise.
That's what the official scales show, yes. But here's the real kicker. The aha moment, if you will.
Go on.
We looked at market data. Estimates for the average annual salary of a general medical officer in TNT right now, it points to something closer to $32,289 per month.
$32,000.
Right.
Compared to an official rate of $15,000.
Correct. The official pay is less than half the estimated market rate.
That's not a gap, that's a canyon. Over 100% different.
Precisely. And that quantified crisis, that huge untenable disparity is what's fueling the retention problems. Doctors leaving the public service, you can see why.
So wrapping this up then, the core insight isn't really about teachers versus doctors' value, is it?
Not at all. It boils down to the system. Your financial reality as a public servant seems to depend heavily on whether you have a strong, functional union and negotiation process, like TTUTA.
Versus a stalled or dysfunctional one, like empathy seems to be.
Exactly. And the problem now, especially in health, is so deep. You can't just slap a small percentage increase on those decade-old scales and fix it.
We didn't even come close to the market reality you mentioned.
Not even close. The way forward, it seems, particularly for doctors, has to involve comprehensive job evaluation exercises.
Not the one agreed for teachers.
Yes. Something to properly assess the roles, modernize the whole pay structure, and align it, finally, with market realities.
So the provocative thought for you, the listener,
Is that without fixing the bargaining mechanism and fundamentally updating the pay structure in health, that staffing crisis,
Right.
it's likely just going to get worse, impacting the services everyone relies on. It needs a systemic fix, not just a patch.